I have treated with SLT since 2001. I have not used MLT and I have not used ALT since then, simply because the effect of the SLT, the lack of side effects, the patient satisfaction, and the both statistical and clinical significant drop in intraocular pressure has shown me that it is a very satisfactory treatment method for glaucoma. We found for primary treatment, meaning patients were not on medication, the 10-year cumulative probability of success was over 90%. For secondary, meaning the patients were on medications and they were taken off the medication, the cumulative probability of success was over 80%. I have repeated the treatment routinely twice, meaning the patient has had one laser, then they've had 2 repeat treatments, and at that point I feel we should go on to glaucoma filtration surgery, either with a shunt, a tube, non-perforating trabeculectomy, or conventional trabeculectomy with anti-fibrotic agents. The most I've ever done is 5 times on a patient who was allergic to all medications and desired not to have surgery. Subsequently, the patient had surgery, non-perforating trabeculectomy, and is doing very well. The efficacy of SLT compared to ALT bears some careful thought. SLT is not ALT light. We presented a paper at ASCRS a few years ago which showed SLT worked significantly better, both statistically and clinically, than ALT. The rule of thumb for ALT is 30% fail at 3 years and 10% fail each year thereafter. We found, using cumulative probabilities of success, that at the 5-year mark, where there would be a 50% failure rate for ALT, there's an over 80% success rate for SLT. Medication does lose effect over time. That is called tachyphylaxis, and the SLT, we find, sustains itself as well or better than medication over time. The duration of SLT works better when it is used as a primary therapy. We have presented papers at ARVO and at ASCRS that showed if a patient is treated with a medication, a prostaglandin first, there's about a 30% reduction in the efficacy as opposed to when the patient was treated without medication being instilled in the eye before the SLT. So for primary SLT, we find we get an average reduction of anywhere between 28 and 35%, depending on the study and on the time frame. For secondary treatment, the reduction in intraocular pressure is significantly less, depending on the study, depending on the time frame, between 21 and 25%. So a good rule of thumb is, for primary treatment, SLT can reduce intraocular pressure by about 1/3. For secondary treatment, SLT will reduce intraocular pressure by about 1/4.